Hello again. Welcome to the information session on PUDR's Health Product Procurement and Supply Chain Management. Today's session will be presented in English, and the session will be presented in French tomorrow for French-speaking portfolios at 1 p.m. Central European Time. We invite any attendees in this call to enter questions in the chat, as we'll have a dedicated Q&A session, which we'll get into in a bit. And we'll collect these questions and project them during that section. We would like to also share to please note this session is being recorded, and by joining the session, participants consent to sharing their personal data, particularly how their username is displayed on Zoom. The presentation and recording will be available, and the link will be shared shortly in the chat for the Global Fund website. Please contact the Global Fund operations@theglobalfund.org if you have any questions. This email will also be shared in the chat for easy access. And we will be sharing a short survey at the end of the session, so we would appreciate if you could take a few minutes to provide feedback. If we can go to the next slide, please. This is the agenda for today's call. We'll have these six sections, and as mentioned before, we will have the Q&A where we will project the questions that you've shared in the chat. With that, I'll now hand over to our colleague, Mohammed Farag, who is a Health Product Management Specialist at the Global Fund, who will begin the presentation of the session. Thank you very much, and over to you, Mohammed.
Thank you, Nicole, and good morning, good afternoon, good evening, everyone. Thank you for making the time to come to this important session related to the procurement and supply chain management metrics, which will be part of the progress update and disbursement reports, which is the main reporting mechanism for the Global Fund grant starting in 2024 for all the high impact and core grants in the GC7 implementation period. The presentation, as you can see on the screen, will involve a quick overview of the procurement and supply chain management metrics. And then we will be going through some of the detailed definitions of the three metrics that we are about to present today, and which I would assume most of you would be dealing with as part of your reporting on procurement and supply chain management. And then we are going to talk about setting the targets for these three metrics and what does that entail, how we would do that, we meaning the PSM teams within the procurement and supply chain management units at the PRs, and the country team, health product management specialists. Then we're going to give an overview of the PUDR process flow, give a little bit about the next steps and some resources that you could tap into for information, and then a Q&A session towards the end to answer any questions that you might have. With that, I'm going to move forward. So starting off, in 2024, there are a few objectives related to the improving the implementation oversight. And 2024, as you might imagine, is the starting for GC7. And few of these objectives relate to trying to optimize the reporting rhythm, strengthening the data quality, enabling a tailored reporting approach, and expanding the use of the partner portal. The expansion of the procurement and supply chain management metrics to high impact and core countries, which have started in 2023 with a small pilot related to 18 grants, is now being expanded to all high impact and core countries, is part and parcel of this of these objectives for improving implementation oversight. There will be further info sessions So look out for these sessions in February and March related to some of these elements and tools, such as the pulse check, and obviously related to the PUDR in May and June. There is obviously some revisions to the instructions of the PUDR, which would be released in all the Global Fund official languages, and it will be shared with the PRs and implementers soon. This session not only relates to PRs, but obviously it also relates to the LFA, who are going to be verifying the information reported in the PUDR. Moving forward. So let's start with giving a little bit of context here, why we're doing this procurement and supply chain management metrics reporting as part of the PUDR. Well, procurement and supply chain management processes, as you all know, are really critical enablers to the programmatic and to the principal recipient performance. And we all agree that the programs that we are running are not going to run effectively and efficiently without being able to have the products that are needed. And so when we looked at the design phase of which metrics we are going to be needing to monitor more closely, we started by thinking what would be the metrics that would establish accountability or more accountability at the PR level when it comes to the PR's performance. And so we started with the planning stage, moving forward to the implementation stage, and then to the actual delivery stage at the country level. I'm going to sort of touch upon each of these points when it comes to explaining the metrics. But overall, we started from the point where equitable access to the quality assured health products is considered as a crucial enabler in the fight against HIV, TB, and malaria. And then we are looking at how effectively the PR is managing these processes to achieve the programmatic performance that is desired. And we want to avoid that we have a weak PSCM system, which would impair overall health system's ability to respond to surges or shifts in the demand, and thus leading to undesirable results such as the stockouts, expiries, or waste. Therefore, and that's the why of why we're doing that, and I think it's a legitimate question for everyone to ask. The additional PSCM metrics, they were added to the PUDR for the high impact and core portfolios to enable the implementers and the Global Fund to identify critical delays and risks and to take corrective actions promptly and when necessary. I'd like to emphasize again that this is currently applicable for reporting only for high impact and core grants that are in the GC7 period. Moving forward. So this slide provides you an overview of the 3 additional metrics that are incorporated in the health products tab of the PUDR for high impact and core portfolios. The first one is the quantification and forecast timeliness and comprehensiveness. So this is one metric that has 2 components, the timeliness component and the comprehensiveness component. And I'm going to explain what does each entail exactly. The second metric is the procurement planning performance. And the third metric is the stock according to the plan. In addition to these 3 new metrics, all the PRs with budgeted health products procurement are expected to continue to complete the price and quality reporting, which is one of the key sections of the health products tab, including the quality assurance and compliance section. PRs will also continue to report on the section related to the risk of stockout and expiry, and the PQR value and reporting compliance in the PUDR. So PQR, risk of stockout and expiry, these sections are not going to change. They're going to remain. Moving forward. We started by, as I explained, by a pilot phase. So it was a phased rollout of these new metrics. So these pilot phase was presented or introduced to pre-selected high impact and core grants. For the selected grants, the targets were set in collaboration between the PR and the CTs for the period July and December 2023. And the results were reported in the PUDR, are being reported now, and will be submitted to the Global Fund in line with the standard PUDR timelines. So some of you are attending the session, were part of the pilot, and now they are going to be expanded to other grants. So some of you would be familiar with the metrics and the concepts that we are going to explain here. Now we are at the phase of the rollout to the rest of the GC7 high impact and core grants, where the new metrics will be integrated in the PUDR reporting requirement for all high impact and core grants for GC7 as of 2024. The target setting is forward-looking and is completed prior to the start of the annual reporting cycle. So the start of the annual reporting cycle will be January, and hence you will see on the next steps that would be trying to set the target before the end of the year. So the second section of the presentation will look at the details of the three metrics, looking at the definition and how we are measuring them and reporting on them. The first metric is the quantification forecast timeliness and comprehensiveness. The timely quantification and preparation of a comprehensive forecast enables timely initiation of the procurement process, order placement, and arrival of the required products to the country. Remember, I mentioned at the design phase, we looked at the planning stage, implementation stage, and also the delivery stage. And that's the first part, which is the planning stage. So that metric is looking at how the PR is planning, how they are quantifying and forecasting for the demand. And again, it looks at two components: timeliness, which is measuring whether the forecast of a selected product category, and I underline product category here, was completed as per the agreed timelines. How we are going to calculate timeliness is basically the average number of days between the planned date, and that date is the target date that you will be setting as a PR with the CT, and the actual forecast completion date for the selected product category. So the product category will be the categories that you choose, that you are going to include in your forecast and quantification exercise. And the timeliness will be measured by looking at the difference between the planned date, which you set as a target, and the actual completion date, or the actual forecasting and quantification exercise date that you have done and you are reporting on. And the LFA is going to verify that. Now, looking at the second component, which is comprehensiveness. And this measures whether all the selected product categories were covered in the quantification exercise. How we calculate that? It's the percentage of the health product categories that were quantified during the reporting period from the total number of the product categories selected and set again in the target for the quantification forecasting exercise. So let's say you choose 4 or 5 product categories as a target, and then you report that you have completed 4 or 5 product categories. The calculation of the comprehensiveness component of this metric is 100% in this case. Moving forward. So the second metric here is looking at the moving from the planning stage to the implementation stage. And here we're looking at the procurement planning performance. The importance of this is signified by the timely and effective procurement of health products, which requires proper planning, where the PRs are required to develop a procurement plan, which in most of the high impact and core grants would be represented by the health product management template. So developing the procurement plan with the detailed health products, quantities, budget reference prices, and order placement dates and procurement channel. All of this information is being set at the HPMT, or the health products management template. The grant procurement or supply plan is ideally derived from a national plan that is the result of the national quantification and forecast exercise. And again, this is the link to the first phase, which is the planning using the quantification forecasting. The outcome of this would be a national procurement and supply plan. And then depending on the grant context, a subset of that would go into the HPMT, and that would detail the procurement plan for the grant. So in a nutshell, the metric is trying to measure the PR's effectiveness in procurement planning and execution, considering the published and indicative lead times by assessing a proportion of the orders placed as per the plan. How are we going to calculate that? It's the percentage of orders for selected tracer health products. And here are underlying health products. It's not product categories, but individual products that are placed on time as per the procurement plan of the grant, which is again here for high impact and core grants, it's the HPMT. Considering the international and national lead times, which by default we would consider that is integrated in the HPMT. When you are setting it's in Q3, year 1 for this order, for this particular product, you have taken into account the lead time for the procurement channel that has been selected. Moving forward. This is the third and last metric of the 3 new metrics for the procurement and supply chain management. And here we're looking at the effective inventory management, which is again a key process in the health product supply chain management. PRs are required to maintain optimum health product stock levels as per the national guidelines for supply chain management and logistics. The metric is trying to measure PR's effective management of inventory at the central level by looking at the proportion of products maintained within the min and max stock level. So in summary, it measures the PR's effectiveness on inventory management at the central level by looking at the proportion of products maintained within the min and max stock levels, calculated as the percentage of the tracer health products. So again, here we're looking at individual products, not product categories, as per the first metric on quantification and forecasting, with stock status are within designated min and max stock levels, as per the central stock report. Moving forward. This slide is providing you an overview of how the revised PUDR is looking like to incorporate the new PSCM metrics. So you could see here that price quality reporting, section 8A, section 8B, risk of stock out and expiry are maintained. And then we are introducing 8C, D, E, and F. Quantification, forecasting, grant procurement, planning, performance, central stock, stocked according to plan. And then there is F, which is additional information that has been added to provide some possibility for the PRs and the LFA to add some contextual information related to the reported values and results. And then section 8G, which is the value of pharmaceuticals and health products in the PQR, that remains the same. The requirement to report on the new metrics applies to all high impact and core portfolios. Focus portfolios will continue reporting on sections 8A, B, F, and G without going into the new metrics. This is a corporate decision to include only the high impact and core portfolios in this rollout. Next slide. Now we're going to move to the target setting, which is sort of the translation of how we are going to measure that in practice and report on it. And with that, I'll transition the slides to my colleague, Manusika Rai, who will be taking you forward with the section on target setting. Manusika, over to you.
Thank you, Mo. Hi, everyone. So just continuing on what Mo has presented so far, I will be explaining the process for target setting and giving an overview of the process flow. Just give me a minute. Okay. As Mo explained, there are 3 new PSCM metrics that has been incorporated as part of the PUDR. The measurement of these three metrics will be based on a set of traces. These traces are either known as either selected based on product categories or products. The selection of these traces is an important part of target setting. There is a consultative process between the Global Fund country team and more specifically the HPM specialist who will guide the PRs on the selection of the traces and agreeing on the targets for each of the traces for the three metrics. What happens next is that the targets are entered into the Global Fund's internal system, GOS, and will be pre-populated into the PUDR form. So at the time of PU and PUDR, when you receive the forms, these targets are pre-populated based on your conversations and agreement with the Global Fund country team. It is important to note that the target setting is annual, but it is possible to modify them as long as it happens before the start of the next reporting period. Next slide, please. So touching a little bit more on these traces. As I explained, the traces can be trace of products or trace of product categories. And here on this slide, we have given an overview of some criteria that you can use for selection. You may select health products that are of strategic importance to achieving the granted objectives and represent major expenditure under the grant. We also recommend that you select core product categories that are such as LLIs, ARVs, RDTs. And when it comes to individual products, we suggest you select regimens that majority of patients are on, are the key product categories that represent a major proportion of the grant budget. For example, TLD, which are first-line regimen and ARVs, and ultimately lumefantrine and antimalarials. In terms of the budget, we have given additional guidance here where you may select product categories that represent at least 50% of the product category budget. In total, we expect that per metric, you select up to 2 to 5 product categories for the quantification and forecast metric, and for the grant procurement planning performance and central stock or the stock according to plan, we recommend selecting up to 5 to 10 tracer products per the metric. A key takeaway from this slide is that it is not mandatory to select all the health product categories that are presented in the HPMT of that particular grant. We leave it to the discretion of the country team and the PR to have a conversation as you agree on the selection of the traces and the targets for each of these metrics. Next slide, please. So on this slide, we present a very high-level overview of what the process flow looks like. I've just spoken about the target setting and the consultation process between CT and the PR and entering them into GOS. Once this is done, the targets will appear in the PUDR form at the time of PU and the PUDR, and we expect the PR will be reporting against these targets. We are also expecting the LFA will verify the PR reported results as part of the normal PUDR process. And once this is submitted to the Global Fund, we will review the data that has been reported and seek clarifications where needed. Next slide, please. The roles and responsibilities. So again, for each of these metrics, the PR and the CT will have a consultation on setting targets for each of the metrics. For example, for the quantification and forecasting, what you will agree upon is the date, the specific date in a reporting period when the quantification is expected to be completed. For example, if you select a tracer a product category, let's say ARVs, you will agree on the date when you are expecting to complete the quantification. So it could be, let's say, October 31st, 2024. That is a target that you've agreed upon for that particular tracer, for that metric. Again, for grant procurement procurement planning performance. Based on the HPMT and your procurement plan, you will agree on a target placement date. Here, the date is not a specific date, but it's a quarter in a year. So for instance, if you select a product and then you can agree on the target placement date for that particular product, could be Q2 2024, Q3 2024. You agree upon that with your country team, and then you enter that into the course. For central stock level, stocked according to plan, you agree on the minimum and the maximum stock levels as per your national guidelines and your SOPs for the selected traces. What happens next is, as I mentioned before, as PRs are reporting on these targets for the first metric, you're actually completing the date when you have completed your quantification and entering that into your PUDR. For the grant procurement planning performance, if your target is Q3 or Q4 2024, you're actually reporting on the date when you have placed the orders. And for the central stock level or the stock according to plan metric, what you're reporting on is your stock on hand and your average monthly consumption. And of course, you also have the provision to provide brief explanation if your stock levels has gone beyond the agreed range, the minimum and the maximum stock levels. And for all these three metrics and the reported data from the PR, the LFAs will be verifying this and also completing the relevant sections of the LFA sections in the PUDR form. And if needed, they will be providing some additional explanation or contextual information that will help the country team and the HPM specialist to interpret the data. Next slide, please. So here, this is a little bit of how the forms will look like. I think I've already spoken about how the target setting will be shown up in the PUDR form. The gray cells are the ones that are pre-populated already, and the yellow highlighted cells are the ones which the PRs will be required to report in. And there are similar columns that LFA will be also requested to fill in. Those will come as, I think, in blue color. And what is important to note here is that there are some targets for which will show up as not applicable for this reporting period. So only targets that are applicable for that particular reporting period will show up in the PUDR form. So if it's in January to June PU, you will not see the targets for July to December 2024 reporting period. What will show up in the form is there will be a small text not applicable for this reporting period. In that case, we do not expect the PRs to report for that particular metric, for that particular tracer product. Next slide, please. Similarly, for grant procurement planning performance, the targets will be pre-populated, and this is how it will show up in your form in the gray cells. The PRs will be required to complete the yellow cells and report the data on which they have placed the orders. Again, as I mentioned before, if it is not applicable for that particular reporting period, there will be a small text showing not applicable for this reporting period. And as mentioned before, the LFA will have similar columns to complete. Next slide, please. And finally, on the stock according to plan here, the earlier remark I made about not applicable for this reporting period does not apply because the targets are annual. What we are putting as targets is the minimum and the maximum stock levels for the different products that we have selected as traces. So here, it does not matter about the reporting period. You will be requested to enter the stock, provide data on the stock on hand and the average monthly consumption for each of the tracer products. And also, you're requested to give an indication of the data source that you have used for this. There is a drop-down option that you can select to indicate the data source you have used. And as I mentioned before, for all the three metrics, both the PR and LFA have provisions to include very specific comments for the data that you have reported against each of the targets to support the interpretation of the data and provide any contextual information that will help the country team and the HPMs to understand the data that has been reported. Next slide, please. Thanks. So with this, we are coming to the end of the presentation. Just as a recap, we've mentioned that the target setting is annual, and it's always forward-looking. So for the year 2024, what we are requesting is the HPMs in consultations with the PRs agree on the selection of the tracer products or the product categories for each of the 3 new metrics. You also need to agree on the targets. Once that has been done, the HPMs will communicate the targets to the PRs and also enter them into Glofund's internal system GOS. We expect this is done before 30th of December 2023. Of course, if they are, because of holidays and other priorities, for this specific period, we have allowed provision to enter targets up until end of January 2024. We have planned further information sessions for PRs and LFAs who could not attend the session today. Both in English and French, there will be further sessions in January 2024. Once the target setting has been completed, there will be, as I mentioned before, during the PU and during the PUDR, you will be required to report against this data, and the LFAs will be requested to verify this data. Here are some resources that we have made available. The PDR form instructions has been updated and will be made available in English, French, and Spanish, and those contain detailed information on how you can report against this data and how LFAs can verify this data. But if you still have questions, please contact your country team, HPM specialist, on any questions on target setting, on the metrics, the products, and the category selection. And of course, you're welcome to join the additional information sessions that has been planned in early 2024. We'll also be sharing the recording of this session and all the materials. This will be available on the Glofund website. Thank you. Over.
Thank you, Manasika. If we go to the next slide, I believe it's the start of the question and answer section. If we go to the next slide as well. We have a couple of questions for our presenters to respond to. If we could go to the first one from Hans-Peter Bollinger, I'll hand over to Mohammed and Manasika and other health product specialists on the call. Thank you.
First one?
Sure. Yeah. The first question is, on what basis work with targets will be pre-populated based on best practice, based on Glofund internal work with the PR? Or okay. So for the targets, firstly, as I explained, the target setting consists of agreeing on the traces. So by traces, we mean either trace of product categories or individual products for each of the metrics. And for each of these metrics, I think you need to have a conversation with your country team, the HPM specialist, on the targets. So for the quantification and the forecast, if you have agreed on a set of product categories, like for example, ARVs, LLIs, and HIV RDTs, for instance, I'm sure you are doing the quantification review and the quantification updates on an annual or a 6 monthly basis or even quarterly basis. What you need to do is have a conversation with your country team, HPM specialists, and agree on the two target states, at least for a calendar year. So for January to June, if you're doing it once, you agree on the target date when you expect to complete the quantification review, enter that agree on that as a target. And then for the second July to December, if there's another quantification review planned, you can agree on that date and enter that as a target. So similarly for procurement planning, I think you all have HPMTs for your specific grants. You've agreed on when you need to place order for specific products. For the selection of the products, again, we have given some guidance on the criteria, but we leave it up to the HPMs and the country teams and the PR to have a conversation on the selection of specific products. And then you can agree on the targets that will be entered there. So for example, if in your HPMT, you plan to place orders for TLD in Q1 2024, that is your target. For the stock according to plan, as I said, the selection is again, the selection of traces is based on the individual products. We have given guidance on how the products can be selected as traces. and the minimum and maximum levels. I think as per the national SOPs and guidelines, I think you would have already agreed on at the central level the minimum and the maximum stock levels you actually maintain. And I think if this has been agreed upon, what we need to do is just agree on the products and then enter those min-max levels as targets. I hope that answers your question, but I also welcome more to add more.
Thank you, Mariska, for a very comprehensive answer. So Hans, I think the slide on the products, on the tracer products, could help answer a bit the question. So here it says on what basis the targets will be pre-populated, and Manusika explained to you the different possible targets or the different areas that we're looking at when we are setting the targets for the three metrics. So if it's based on best practice, now let's look into this a bit. So when it comes to the selection of the products, for example, the guidance here, we are looking at, you could consider it best practice when you are choosing a product which represents the major or the majority of the expenditure of the grant. When you're choosing a product which is representing a strategic importance for the grant, let's say you're an HIV grant and you're looking at a key product, so let's say the first line TLD, which is recommended by the World Health Organization for the treatment of the people with HIV for first line. And so this is one of the strategic products that you would select as a best practice as part of your tracer product. If that product is representing a major expenditure, then that strengthens that selection. It's a core product as well. And so from that perspective, you would apply best practice when you are selecting the tracers, and the guidance on the slide would give you further details on how to do that. There is a second question, anonymous. How about the accuracy of the quantification and forecast? It would be useful indicator of the quality of the forecast. And I can't agree more. Nevertheless, I have to take you back a little bit to the conceptualization of having the metrics had to take into account the different maturity levels of the different systems, all the universe of grants for the PRs that we are having. And quantification forecast accuracy is a key and important critical component of the procurement and supply chain management system. I would say when you have a developed or mature PSCM system, which we all know that there is a variance in the level of maturity amongst the different PRs. So the information needed to be collected and the systems, talking about information systems that are needed to be able to have a verifiable indicator or a metric and being reported on by the PR and being verified by the LFA for accuracy, we thought that this would be a later stage metric than to choose it at this point in time. And so point taken that this is an important and key critical metric. It will probably come at a later stage in improving the implementation oversight. But for now, it's not included. Please.
Thank you, Mo. I think we can move on to the third question, right? I think here, how to define the tracer items based on 50% total cost. So do you want to come in here?
Yeah, thank you very much. On target selection, we will try, as Mohammed said, to identify the important and strategic products for the grant and for the program. And one of the criteria that will be applied will be the cost of the products. So we will try to focus on products that has a significant value under the grant and do not represent the minor spend category. So we will identify, for example, those products or few products to cover the 50% of the cost, for example, of antiretroviral medicines. Or, for example, if grant procures 3, 4, 5 different RDTs, we will try to identify those that cover the 50% of the RDT's cost. So this is to ensure that we spend our energy and our effort on the matters that count and that are important. So we try not to create a lot of workload for the PRs and a lot of reporting requirement, and focus our efforts where these efforts matter. So you will always see that tracer medicines or tracer product categories selected normally represent the significant or majority value of the health products management template. This is a high-level blanket rule that will be applied by country teams and HPMs. But as Mohammed and Manusika outlined, there might be some outlier cases where different products might be selected, and the value will not be exclusively based on value of the product included in the HPMT. Yeah, thanks. I will also take the fourth question regarding the LFA's role in the target setting. So LFA's role will be to verify the results reported by the PRs in PU and PUDR template, and this is where LFA's role is mandatory and clearly outlined. Regarding at the time of the target settings, LFA will be kept informed, but there is no mandatory engagement or mandatory role for the LFA at the time of target setting. Target setting will be mostly handled by the country team and the PR. We discussed between these two parties, but country team may, as and when needed, refer to the LFA to identify, for example, strategic products if needed, or to verify whether the store minimum and maximum stock level, for example, proposed by the PR are actually as per their SOPs and as per their guidelines. Yeah. Thanks very much.
Thank you, so the question number 5 from Chavi: will the PUDR instruction guidance will be revised and to include the PSA metrics? Yes, so we have just completed a revision of the PUDR instructions to include guidance on how the PR should report against this metrics and how the LFA should be verifying against it. So the instructions has been updated, both English, French, and Spanish, as I mentioned earlier, and they will be, I think, published on the website shortly. I don't have an exact date, but definitely the instructions has been updated. Thank you, Nova.
Countries giving guidance on tracer health product selection. Yes, that is part of the slides. You could refer back to it. Other resources would include the HPM specialist of your country team. In addition, in the PUDR instructions, that would also be included. Question 7, Anita Victor. Thank you for the presentation. Are the targets for tracer items specific to the products funded by the Global Fund, or those from government funding as well? So it's a good question. The metrics here are prioritizing products that are funded by the Global Fund grant. So that's the short answer to the question. Nevertheless, there is flexibility to actually include other products which are co-financed or which are completely funded by by other sources such as domestic financing or other partners. Now, when it comes again to the selection of the tracer products, this is a staking point. So products which are strategic for the grant, products which are important for achieving the grant objectives and the programmatic outcomes that are desired. Even if they are not funded from the Global Fund grant side, or measurably funded by the government or other sources, can actually be included, and we would encourage that in this context. So that's the answer to your question, Anita, and happy to follow up on this in the chat.
Thank you. Question number 8. I think, Sosa, do you want to take that one?
Yeah, thanks very much. Question is whether the HPMT itself is forecast or not. So HPMT is not the forecast. HPMT represents a list of the health products that will be procured by the grant and is based on the forecast. It may represent fully or partially the identified needs. This is one. Second is HPMT can be considered as a product or byproduct of the quantification and forecasting, and needs a regular update, because once the forecast is prepared for the entire grant, it covers the 3-year of the implementation period. But as you know, needs change on the ground. Therefore, we encourage and recommend the PRs to conduct the quantification more frequently, and particularly at least once a year, to identify and factor in the real implementation realities and modalities on the ground. So yes, HPMT is one of the products from the quantification and forecasting, and if HPMT is updated, this may be considered as a completion of the quantification and forecasting. But presence of the HPMT by itself, especially for the one prepared in year 1, does not constitute completion of the quantification for 2nd year or 3rd year. On ninth question, it's a set of different 4 questions actually. So as I already mentioned, target setting does not have a mandatory involvement of the LFA. LFA's involvement is optional and will be approached by the country team if needed and when needed. As I mentioned, to identify some of the products to set as a tracers if country team feels that they need a LFA's consultation, for example, to identify the strategic products that are not procured under the grant, or to identify the regimens or products that are used by majority of the patients, or to verify minimum and maximum stock levels applicable to this or that product. But again, during the target setting, there is no mandatory role for the LFA. LFA will be informed, and LFA's involvement will be optional and will be decided by the respective country team while setting the targets. In case of selected tracers, whether alternative products can be considered or not. So right now, LFA will be required to stick to the tracers identified in the PU or PUDR template, and provide its analysis on the identified tracers. But if there are poor results or certain targets were not met because of this presence or absence of the alternative products, this can be provided by the LFA under the comment section, but the assessment, LFA's assessment, should primarily be based on a tracers that are identified and pre-populated in a template. Regarding the supporting documents, yes, supporting documents need to be submitted by the PR. This will be normally the updated quantification worksheets, or this will be some minutes of the meetings of the quantification workshop or quantification meeting, approval of the quantification, or it can be in many different forms. In terms of order placement, this can be a one-board acquisition, or can be a purchase order or a contract issued by the PR. And in case of stock according to the plan, this should be a stock report and that is already provided as of today as one of the mandatory requirements, and the documents showing annual monthly consumption for the product. This will be the requirement for PRs to submit as supporting documents. But as you know, and as LFA well knows, there are sometimes incomplete submissions from the PR. So this is a normal practice when LFA seeks clarification from the PR and obtains the missing documents if there are any. So this is pretty much a standard practice, not only for procurement, but overall for the whole PU and PUDR review. Yeah, on target setting, we are mindful of the limitation of measuring the stock levels only at the central level, but we've been discussing this point was one of the particularly discussed points internally. We had a lengthy discussion on this. We know that central level of measurement alone has some limitations, but we are also mindful that getting the peripheral level stocks are not always easy for our PRs. Sometimes sometimes data do not reach on time. Sometimes there are data quality issues, and our PRs need to clarify the data points and engage with respective entities on clarifications. Sometimes data comes in, but it comes with a delay. So all in all, if we mandatorily required inclusion of the peripheral or facility stock levels into analysis too, this would potentially cause delays by PRs compiling these reports and submitting to the Global Fund, or could affect the data quality submitted by the PRs. So for this reason, it was decided and taken a decision to limit for now the measurement to the central stock level, because this is the place where in most of the cases stores the highest volume of the health products, and data is available more or less readily and easily accessible. So to facilitate the reporting and also relieve some pressure and some additional workload and avoid delays in report preparation by the PRs, we have taken this decision. This being said, we are aware of the limitation. We are also aware that there are different implementation arrangements in different countries whereby some products are distributed through avoiding the central level at all, for example, and are pushed directly into the peripheral warehouses. So we are monitoring the situation. We will be looking into this, and possibly we will evolve these metrics in the future by expanding the coverage to peripheral and possibly to facilities. But this will require update of the guidelines. This will require update of the guidance. And until then, we will be focusing only on central stock levels. Yeah, thank you.
Thank you very much, Soso. And in case everyone is surprised, Soso was one of the key alchemists for developing these metrics. And just to add a bit, so Nicole, if you go to the previous slide, to what Soso mentioned on question 8. So the HPMT is an outcome, but this metric is trying to actually measure the, so could we go back to the previous slide? So the metric is trying to measure a process rather than the actual outcome. So the process here is looking at the actual quantification and forecasting, which is the planning stage that we are looking at, if it has happened on time or timely, and if it included the categories that should have been included. And then, as explained also on the LFA involvement, the LFA will be only involved at the verification stage, similar to what they are the role right now when it comes to the verification of the data reported by the PRs. And the PRs will be providing the supporting evidence as they do with the current practice. Now, obviously, if the evidence or the supporting documents is not complete or requires further information to be provided, this can be requested by the LFA and reported in their section of the PUDR. The tracer products has to be the ones that has to be reported as per the ones selected at the time of doing the target setting. So they cannot change within the implementation period or within the reporting period. After the reporting period start date, if the PR and the CT have set specific tracer products with specific targets, then they will have to stick to them when it comes to the reporting and review of the metric. So just a few points that I wanted to complement to Soso's answers. And then question 10 from Hans again, I'm still a bit confused about the expected interaction between PR, LFA, and CT. So Hans, in a nutshell here, PR and CT sets targets post this session or post the information sessions, which are made with the objective to inform the PRs about this rollout and to explain the metrics so that they can engage with the CT to set the targets. Now, once targets are set, agreed upon first between the CT and the PR for the 3 metrics, the HPM specialist will take the agreed targets and enter them in the GOS, which is the Grant Operating System for the Global Fund, so that they are pre-populated when it comes to releasing the PU and PUDR at the time of reporting to the PRs. And once the time of reporting comes in, the PR will have to report, and the LFA role will come in to verify the data, similar to their existing role in verifying all the information being reported in the PUDR. So I hope that clarifies the question.
Thank you, Mo. So for question 11, will the HPMT data be pre-populated in the metrics? How to decide which items to include in the metrics by all core products? So as I said, yes, HPMT, the data in the HPMT is definitely one of the sources that you will use, but it is a conversation between the PR and your country team, the HPM specialist, on which specific products you would like to select as tracer for including targets as. So your HPMT has a lot of products and product categories, and depending on the metric, we have given some guidance on which on selection of products that are of strategic importance, including products that represent at least 50% of the total product budget. So these are some criteria you can use to select the products from the HPMT. But it is not mandatory that you select all the products and product categories that are being funded under the grant. I hope that clarifies. Question 12, do we only focus on growth and supported items, or government funded critical items would also be added as tracer items? I think Mo has spoken to this previously on saying, well, the focus is on the growth fund grant supported products, but if there are other strategic products that are funded from other sources, including government resources, you may decide to select that as a tracer product.
And maybe I would like to add into this, because it's a good segue to one of the questions that came from some of the PRs informally. So the 3 metrics here looks at grants which are obviously high impact and core, but which are having health products procurement as part of the grant. So they have an HPMT. There is also the situation where you will have grants which are not having health products, which are not having an HPMT, but it would make sense to actually include some of the metrics and report on them when it comes to the PUDR. And related to this question, when it comes to, for example, grants with NGO PRs, so let's say grants which are focused on prevention of HIV, which is very common within the Global Fund operating model. Now, these grants would be not procuring, because in most cases they would depend on the government system, procurement system, to be procuring the condoms, the lubricants, the prevention commodities to them. They would not be doing the quantification forecasting, although they would be participating on it, but the actual accountability and responsibility would remain within the government PR. But when it comes to actually managing the stocks in the stock situation, it might actually make sense to include and report on this metric to them. So the stock according to plan here applies to them. And if these products are not funded by the Global Fund grant, but they are the part and parcel, they are the core products that the grant on prevention is using, then this should be prioritized. So in this case, you would choose condoms, lubes, for example, and or maybe self-testing if you are doing the HIV self-test, and focus of the rollout is on community-based screening, for example, which is quite common again. Then you would include it as one of your metrics. And again, this relates to the discussion that the HPM specialist of your country team will have with the PRs. So I just wanted to emphasize this, since it's one of the questions that we got informally, but also it relates to answering the question from Masood: if the products are not funded by the grant, but by the government or other sources, but they are still key and important to the grant, then they should be part of the reporting and the metrics. Okay. Next question by Raymond Bondu from PNG. If quantification is only done once annually, if we report once in the PUDR in the last 12 months, does it affect our performance? Or we are to request them to do it twice or 3 times a year? So absolutely not. The metrics follow the process of the grant of the country. So if it's a once a year quantification forecasting exercise, and this is maybe very well the case for many grants, many countries, that they are doing only once, then you only select one date for the timeliness and the completion of the quantification and forecasting exercise. So let's say you're doing your quantification forecasting exercise on the 15th of January, 2024, and you're not doing it again, you're not revising it again. That's basically your process. Then you set the target for the 15th of January. You're doing it on the 15th of June, then you set the target for 15th of June once a year.
The next question is anonymous. Why is stocked according to plan only for the central level? So I think, Sosa was also explaining about this, but so we are mindful that data from different levels of the health system, especially from the lower levels, peripheral levels, may not always reach the PR or the central level in a timely manner. We are also mindful of the challenges with data quality. So to avoid complexities in reporting and delays in preparation of reports, we have decided to limit it to the central level only for now. However, these metrics allow us to have a better oversight and monitoring of how the supply chain systems are functioning in the country. So we'll definitely reconsider this approach, and as we learn from this more, there's definitely an opportunity to evolve this indicator to lower levels as and when ready.
And just to emphasize the point on flexibility for between the country team and the PR in setting the metrics, particularly related to this metric, there might be situations or there might be grants that are not having a central level storage. We expect that these grants will not be many, but this situation might arise and they will have to have a solution. So here it comes to the point where the central level is only used as a path through. So let's say you select a product in your tracers that is not stored at the central level. So it just comes for a week, and then it moves into the province, into the state warehouse. So in this case, it doesn't make sense that you set a metric for this product. But if this product is essential and you want to include it for other reasons, then in this case, you could discuss with your HPM specialist. And some of the solutions that we have been discussing and proposing here is to think about the number of state warehouses where these products will stay for a longer period of time, so that they are measured for the min and max stock level. and think about an average of these, of the min and max stock level at these state warehouses or these provincial warehouses. Obviously, we don't want to go further to the district or to the HILS facility, to the service delivery point, because that would be a large number of data points that would be challenging to collect. And so we would want to keep it to the state or province warehouse, which is the next level after in the supply chain after the central warehouse. And in this case, you'll have to discuss with your HPM specialist, decide if this tracer product is absolutely essential. And if it is, then you select the, you can take the average of the min and max stock level within the state and provincial warehouses. You could even prioritize some of the key state and provincial warehouses depending on disease burden or other criteria so that you can take it into account. So again, thinking about this in a more pragmatic way, in a solution-oriented way, is one of the things that we are considering. Since as Soso and Manuska mentioned, this is one of the metric which has some limitation because of that. Over.
Thanks, Mo. So question 15 from Ershad is additional question 8. However, we have prepared the HPMT based on the forecasting qualification, agree that it may not be fully valid throughout the implementation period due to changes in consumption pattern, but for the first year, it is a resultant output of the quantification and forecasting. So shall we follow HPMT as forecasting and quantification list for year 2024? So here you're based on the quantification forecasting exercise, you develop a procurement plan which is reflected in your HPMT. So your HPMT is not necessarily a forecasting or quantification document per se. It is your procurement plan that has been informed by your quantification forecasting exercise, whether you do that annually or on a 6-monthly basis or on a quarterly basis. So the HPMT for 2024 that you have, you can use that as a basis to inform your second metric, which is the grant procurement performance planning. So where you have selected some tracer products and then you have identified which quarter of the year you're going to be placing the orders in. However, we also note that you will be reviewing your qualification during the course of 2024, which will subsequently affect your procurement plan moving forward. So let's say towards the end of 24 or for 2025, your procurement plan may need to be adjusted based on your quantification exercise done in 2024. I hope that clarifies. Want to take the next question?
Yeah, so again, just to add to what Manuska is mentioning, and not to add actually, but just to re-emphasize the point mentioned, because that question I think shows that the concept needs a bit of clarification. Here we are looking at a process metric. It's not an outcome metric in this case. If you're looking at an outcome metric, we would measure the accuracy of the quantification and forecasting. And that's, as I mentioned in one of the questions, this is probably coming at a later stage of the improvement of procurement and supply chain of health products oversight. So it's looking at the process here, and the process is what is included within your exercise, within your planning exercise, which is a quantification forecasting exercise, and how timely are you doing your planning so that your whole process, which is dependent on that planning stage, is actually going at the right pace. So I hope that clarifies. The HPMT here is an outcome. It's considered as a supply plan or a procurement plan, which could be used in the second metric. But when it comes to quantification and forecasting process, this is not related really to the HPMT. I hope that clarifies, Ershad. But please, if it doesn't, we can follow on in the chat. Okay, thank you. Question 16, will these metrics be applicable to health products purchased by PR or only these purchased via Wambo? So it depends on the tracer product, right? If the tracer product is, we are agnostic to the procurement channel here. So if the tracer product is procured via Wambo, if all your tracer products are procured via Wambo, if you are a Wambo country or grant, then it will be via Wambo. But if it's a mix, it's a mix. And if it's all procured via non-Wambo channels, so be it. That's fine. Question 17, for countries that conduct annual procurement system, there will be a time when we have a low stock while waiting for the next batch of procurement, since we have pushed it to the province. So this time we might be considered not meeting the target. Very good question. So I'd say the answer to your question is twofold. So one of it is you have to take that into, if your system is once a year procurement with a bulk procurement, so you're procuring the whole needs of the year and maybe a 6 months buffer or even a 12 months buffer, so you're having a big stock to hold on. You have to take into account that cycle when setting the target. Don't set the target for the time that you know that you will be not having stock. That's not the point. So the point here is to try to look if you're keeping the products within the min and max stock level. And this is again transitioning to the second part of the answer here, is if you're, looks like to me that this is a situation where, as I was explaining, this is a path through. So you're just getting the product once a year, storing them for a couple of weeks, a month's max, and then moving them to the provinces. So you're not really using the central storage as it should be, as it should have a min and max stock level. And if your SOP is like that for this particular product, I imagine it's not for all your products, but for particular products that you have this, for example, like the Air Alliance, for example. So if this is actually the case, think about these products, if they should be included in your tracers. Another solution would be to look at the key state and provincial warehouses and look at the stock levels at these warehouses and take an average of them when you are reporting on that metric. And that has to be documented, agreed first with your HPM specialist, and then documented when you are reporting on this in the PUDR, so that also when the verification happens by the LFA, this is being taken into account.
Thanks, Mo. I think the next question is similar to the one that you have just answered on some program normally places the entire order 1 year from the beginning of the year. How is this going to be considered? I think your response to question number 17 on annual procurement system has answered that. Hopefully that's okay from Makori.
Great, and with that, I think we've reached the end of our session. We have no more questions in the chat, so I'd like to just close on a few notes. I'd like to thank the presenters, so Mohammed, Manusika, and Soso, who were answering questions throughout the chat and sharing the latest updates on the PUDR. And I'd like to thank all the participants for joining us today. Before closing, we'd like to share a short survey in the chat, and we would appreciate if you could take a minute to provide feedback on the session. So thank you all again and enjoy the rest of your days. Bye.